Hi, I'm Dr. Anita Krishnan, an ENT surgeon with over 30 years of experience, specializing in airway allergy and allergen immunotherapy at Bangalore ENT Care Centre, Koramangala, Bangalore. Today, I want to discuss with you the common indoor allergens. An allergen is a protein particle. If you are a sensitized individual, your immune system hyperreacts to. The commonest indoor allergens are house dust mite, dander from animals, pets, cats, dogs, moles on the wall, cockroach. That's another important indoor allergen. Now let's look at one by one. House dust mite is the most common antigen which causes problem in people. There are three types of house dust mites which are very commonly seen in India, not only in India, all over the world. They are called DP, Dermatophagoides teruensis, DF, Dermatophagoides farinae, and BT, Blomia tropicalis. Blomia tropicalis is particular to tropical countries, whereas DP and DF is seen all over the world. It's ubiquitous. It's the same in America, it's the same in Europe, it's the same in Africa. There are a few more other dust mites also, Uroglyphus, Thyrophagus, Acarus. These are not that commonly found in the skin prick test as much as we identify the DP, DF, and BT. Now, when we come to moles, there are many moles, of which the most important or commonly we check for is Aspergillus and Alternaria. Now, these moles can sensitize us and cause, especially in the ENT domain, allergic fungal rhinosinusitis. This is very different from the mucor or the black fungus you all experienced during COVID time. Black fungus or mucor is an invasive fungus. It gets into the blood vessels, it gets into the tissue, it eats the tissue. That doesn't happen here. In allergic fungal rhinosinusitis, which is caused by Alternaria, Aspergillus, Cladosporium, what happens in allergic fungal rhinosinusitis is that we breathe in the spore of maybe Alternaria, Aspergillus, Cladosporium, one of those indoor allergens, one of those indoor mold spores, and the spore goes and gets entrapped in the sinus. If you are a sensitized individual, which means your immune system does not like particular antigen, your immune system will hyperreact to it as if it has seen a virus or a deadly bacteria and try to find it, and in the process produce a lot of mucin. This leads to persistent sinusitis. Normally this is found as unilateral, one side, but of course you can find that both sides of the sinuses, paranasal sinus groups, are involved. The other indoor allergen we all have to be very, very cautious about is cockroach antigen. Now you would wonder, what about the cockroach is antigenic? It is actually its digestive parts. So we ourselves cause more of antigenicity or more of problem with the cockroach antigen. When we see a cockroach, we take a broom or whatever is right next to us and we thrash it and kill it. When you thrash it onto the floor or onto the wall, the digestive parts basically spreads around, it dries up and it's in the air. So cockroach antigen is very difficult to treat, and it is dangerous because people with allergic rhinitis, if they live in a place with a lot of cockroaches and exposed to cockroach antigen, they can go on to get asthma. Anyway, people with allergic rhinitis, 40% could convert into asthma when they grow older. So it's very important to avoid cockroaches if you've been identified as cockroach sensitized in an allergic rhinitis evaluation when you're doing a skin prick test. The other indoor antigens which I have to mention are cats, dogs, cats especially. There are a lot of patients, in your history you will know that when you're exposed to the pet, your symptoms become more, your eyes are itchy, watery, your nose is itching, you're sneezing, then you obviously realize that you probably have a problem with the pet. The best way to come to a conclusion is to meet a doctor who is trained in allergy, who can perform a simple skin prick test for you and find out if you have a problem with the pet and how you have to manage that pet allergy. You have an issue with allergic rhinitis or sinus symptoms, it is good to be evaluated by an ENT surgeon with special interest or training in allergy to find a long-term solution. These problems can be sorted with allergen immunotherapy. A similar interesting thing could be happening in Bangalore too, because over the last 2 decades, especially young IT professionals have moved into Bangalore from mid-tier cities and smaller towns. Their children are born in dense urban environments and they are exposed more to indoor allergens. They do not get an opportunity to be exposed to the outdoors and have environmental exposure to more microbiota in the outdoor areas. And also in the schools, they are always indoors. They are hardly playing in the playground. And many of my patients will say, I don't allow my child to go to the sandpit. Those are the situations where children get exposure to microbiota and their immune system learns to adjust or become tolerant. When we are bringing up children in highly sterilized environments, they do not get a chance, or rather their immune system does not get a chance to have immune education. So obviously they tend to think that every little thing like dust mite antigen, which they're supposed to tolerate, or pollen or a fungal spore is something to fight. So they develop allergies and asthmas much more. This could be an interesting explanation why it is more in children who are born in urban situations coming from parents who were not exposed to urban situations. Now, the interesting part is that you may not have to leave the city to become okay. You can meet an allergy specialist or an ENT surgeon trained in allergies, do a simple test called the skin prick test, identify your allergen, and look at a long-term management. Thank you for watching.